Strict COVID-19 measures are often criticized because they come at an economic cost. But we rarely ask the question, well, what's the economic cost when COVID-19 infections run rampant as they are in provinces like Alberta and Saskatchewan right now? Consumers don't want to go out. They don't want to go to restaurants. They don't want to shop in stores because they're worried about catching the virus. So I'm going to talk to Dr. Lindsay Tedd, who's an economist at the University of Calgary, about that. Welcome to the interview, Lindsay.
Thank you very much for having me back.
Well, here's the question. Is there more economic damage by putting in place strict pandemic management measures to get infection rates down, or by opening it up and just, letting businesses operate as usual? What's your take?
Yeah, well, this is where we want to take a look at, how consumers are responding. Consumers only go out and spend if they're confident, if they're feeling like this is, something kind of safe to do, and it's a safe and viable option. And really what we do see is, of course, about 70% of individuals are obviously opting into the vaccine. And there's broad public support for restricting the activities of individuals that are not vaccinated. So as these restrictions sort of roll out, that's where we'll see this division of people frequenting businesses that match their preferences. Those unvaccinated will frequent businesses that don't want to bring in any of these restrictions. But I guarantee you, individuals who support these restrictions will not be frequenting those businesses.
So is it fair to say that in general, and I don't know, I haven't seen anybody reference studies that have looked at the question of what's better for the economy, restrictions or not restrictions, but it sounds like, that this trope that we're seeing on social media, that restrictions do a lot of economic damage, probably isn't borne out by the data or economic theory.
Yeah, this is one of these ones that, this is where you're ignoring the actors in the market, right? I mean, this is the idea that, you let people do whatever they want and they go back out there into the economy. But again, if they're not confident, they're not going to. And certainly we see in jurisdictions that have had to go back and forth between restrictions and then wide open and then restrictions and wide open, we're just not seeing consumers re-entering in the market in any way in droves to get that outcome that they think is going to happen. Again, we have to remember, people don't want to get sick just to go out to a restaurant. And when a lot of the consumer confidence and spending is actually driven by families, and we have kids under 12 that are still waiting to be allowed to have a vaccine, those families are not going to risk their kids' health, both short-term and long-term, by exposing them to the virus. So I think it's really just making sure that we understand who has the money to go out and spend, and what are they wanting to see in terms of the safety of economic activity.
Here's one that comes up quite often on social media, and that is some industries like restaurants are facing shortages of workers. They can't get people to go back and work, but those are industries that have a reputation, whether it's earned or not, of being a little risky around COVID infections. And if workers don't have confidence, they're not going to go back to work. Is that a fair assumption?
Yeah, it is. I see way too many people blaming income supports. Like, I'm sorry, if you are still earning a poverty wage at your business and a poverty wage is more appealing than that, then I think the wage that you're paying as a business owner, you really have to rethink that. But we have to understand that people have gotten sick, people have died, and people are in fact assessing their risk in their profession, and that maybe they need to move to another profession. And we've already seen that in the particularly the restaurant industry. So people aren't just going to stay around for the status quo. And that's the beautiful part of the free market is that everybody can, in fact, reallocate their labor. And if the wages aren't respecting the risk level that is now in these areas, well, that's on the free market to address. And you address that by raising your wages. You don't blame supports that are available that barely pay people as much as what you would pay in a full-time minimum wage job.
I've had a couple of interviews lately where risk assessment by individuals comes up. And it seems to be the view that rules that aren't clear, rules that aren't strict enough, confuse people and lead them to, then they don't know how to properly make a risk assessment. They don't have the data, they don't have the expert guidance, they don't trust the government, on and on. And is that a fair sort of observation, Lindsay, that we need clear rules, clear data, clear guidance so that we can do our own personal risk assessments and feel confident in?
Yeah, and the more these things are going back and forth as they have in Alberta, and where a recent very poor decision is making everybody go, to what point do I now trust my government and the public health authority because you made a bad call a couple of months ago? Now where are the calls coming from? So it's also important to remember personal risk assessment varies along very particular lines, and in particular gender. Gender is really important for understanding risk assessment. Women, especially mothers, are not a risk-loving group. We're very risk averse. We want to make sure that we're not putting ourselves as a support for the family, as well as putting our family at risk. So we are more likely to be responding to uncertainty and asymmetry and changes that are not rationalized or make sense in very different ways than other people. So there is an overall effect, but there's a very, very clear gendered effect here. And again, if it's families that drive, which families do drive a lot of spending and confidence, if the moms are uncomfortable, there's just that really is going to drive a lot of household decisions.
Now, you live in Alberta, and I'm familiar with the controversy that are going on there around, the UCP government's policy decisions and the decisions made by Dr. Dina Henshaw, the chief medical officer. They're very, very controversial. But, in British Columbia, where things aren't quite as bad as Alberta, there are also concerns around transparency of data, that the government is kind of not being as open about infection rates and so on as they should be. Mm-hmm. And it seems like that leads to a crisis of, not a crisis of confidence, but less confidence by citizens in making those risk assessments.
Yeah, BC is an interesting case. I have to admit, as a former British Columbian, I have actually been following how things are unfolding there. And the government, while not as terrible as the one here in Alberta, the BC government has actually struggled a great deal in the same kind of ways. I mean, we've had a lot of public information here, whereas in BC, they seem to have really held it tightly. But information is what helps people. Like when people are uncomfortable or what have you, they want to go and get information. And it's better to get the information from the government source than from, I don't know, some other places. So BC, I think, has been quite fascinating. They did very, very well in that first wave. And then things just got a little weird in the second and third wave and struggled a bit with communication. And I think Bonnie Henry had a few missteps, which were very concerning to the crowd who are looking for restrictions and supports. The photo at the hockey rink without the mask, I think, is the one that went around quite widely. And yeah, all of these things make people wonder, like, do I need to wear a mask? Do I not need to wear a mask? Or what is safe? What is not safe? And if I don't know what's safe, then I'm not going to do it.
So just to wrap this up, Lindsay, is it fair to say that reasonable measures, clearly communicated, information given to citizens so that they can make reasonable risk assessments, all of that is better for the economy than just kind of, throwing up your hands and and having confusing or very, almost no pandemic measures in place.
Absolutely. Without a shadow of a doubt, that is in fact true. And what is even more poignant is making sure that you keep people's trust in government over the long term, because this information, the missteps governments have made and what they haven't shared with people will come out. It always does, right? There's going to be inquiries. We're going to have that information. And the more and more we erode public trust in our government institutions, actually, well, I mean, it leads to the rise of the PPC, for example. We need to make sure that we keep trusted institutions. And sometimes, often, that means favoring the release of information to ensure that we maintain public trust in government.
Lindsay, thank you very much for this. Really appreciate your insights.
Thank you for having me.